Heroin and cocaine are tearing right at the heart of Mombasa. Loved ones, men and women, the weak and strong alike are turning into zombies. Children are not spared.
Nimechanganywa na rosta na cospam heroin.
Unakuwa tight. Lakini ukipiga hii kitu una loosen up.
Those hooked risk catastrophic organ failure, coma, and even permanent brain damage, hysterically descending into dark madness. Addicts of the powder have turned into thugs. Like musketeers in the horror movie, they roam the streets at night armed with everything crude, your head or valuable for the substance. The dismembered victims of their brutal act tell a gory experience. It's either life, prison, or death. Tours have tales with Mondia went undercover to the streets, where buying heroin and coke is as easy as buying avocado from Mama Mboga, and presents the bold findings, confessions, and the good Samaritans going to the trenches to give this affected population a second life.
Don't help, don't punish.
The brutal fact is, these drugs do not fall like manna from heaven. They are manufactured somewhere, transported into Kenya before finding their way down to the streets and villages, sold by people with flesh and blood like you and me. Are we saying we don't know? They call it unga. A single scoop takes you high closer to your maker, faster than NASA's spaceship. The racketeers have a powerful web of network, from those that be in the world of business, politics, trickling down to lesser mortals in the streets. They are powerful, well-connected, feared, respected, and protected. They bribe anyone and everyone. I take a deep dive into the underworld of powder. The findings are shocking. Close to epic scenes, cut straight from Mexico's drug kingdom of Sinaloa. Addiction, slavery, murder, sex, a consortium of everything evil. This is Mombasa, the second largest city in Kenya. Despite it being known globally as a tourist destination center, it has become the world's new drug trafficking hub. Ships from Pakistan with cargoes of heroin containing poppies harvested in Afghanistan and refined in Pakistan make their way here, creating an edge to this multi-billion-dollar industry. I'm off on a fact-finding mission to understand how these drugs are distributed from the port of landing down to the streets. My first lead takes me to Freya Town, a place of historical importance. In the 19th century, slaves en route to Zanzibar, freed by British Navy forces, were settled here. It's a mixture of men and women, young and old, openly consuming what otherwise should be forbidden and banned. With my hidden camera, my attention is drawn to the babies idling around. Some are too young. They sit on their mothers' laps innocently but routinely inhaling the emissions from the chimney of coke, heroin, and bang smoking adults. Directly, they are introduced to addiction. I'm somewhere in Freetown, and right behind this wall is a drug zone where all types of drugs are being used: cocaine, heroin, bang, and many others. Now in Kenya, the government has a policy that if you're found in the drug zones or anywhere where the drugs are being used that is unmarked, you can be jailed for up to 10 years. But the big question is, what is the government really doing about the drug lords? Some of the confessions are chilling. A few agrees to talk to us on camera. Fatma, just like majority of women in this dance, is both an addict and a commercial sex worker. A single mother of one lost her husband to mob justice. A fellow addict had gone on his daily errands when he was caught, beaten, and burned to ashes on her watch. With a mouth to feed and cravings to quench, her business has no time, place, nor limit. It happens anytime and anywhere when opportunity arises, many times. In some cases, she's forced to steal from the men buying her to quench their sexual lust, a practice that at times turns tragic.
Ilikuwa ya uizi, kwenda mbio uibe, upate wajiuza mwili wako, upate kupona. Places kama bar, unaweza enda bar, ukapata mwanaume ni mlevi anakutongoza, anataka kukununua, so obvious. Ukiangalia pesa yenye anataka kukulipa ni pesa kidogo, so inabidi challenge naye. So babake alipopata ajali, uraibu nao ulivyomuingililia vizuri, akakuja wakaenda kazi zao, kuja kusikia anapigwa Bombolulu huko. So alipigwa akachomwa na huko.
Surprisingly, the suppliers of these drugs are known. They are highly respected and feared. Their networks span across the borders of this republic. These drugs are spread across Mombasa, even to the villages. Next, I head to Bamburi, a moderate town in Kisauni sub-county of Mombasa. I'm in Bamburi and I'm heading into the streets to see those who are using drugs, different types. I'm told they are heroin, cigars, and every other drug. So let's go and witness to ourselves. And it's a little unsafe, so we'll do what we can. The surrounding air is choking in a cocktail of smell. The thick stench heralds my arrival. In some areas, open sewers flowed undisturbed. Raw human excrements mingling freely with everyone. Welcome to the kingdom of heroin, cocaine, and bang. The environment is frightening. Just like in Freya, majority are already in their world, seated in zombie-like positions, motionless. Some continually hit their head against concrete walls, wailing. We meet Victor, John, and Miriam, not their real names. For the first time in my life, I come face to face with heroin and cocaine and their addicts.
Mimi kusema kweli nilianza kutumia staff kulingana nilikuwa nikisoma shule iko mjini. Nilikuwa nikisoma Serani Secondary School na nikashikana na vijana wa Kiswahili Kashikana na vijana wa Kiswahili ambao walikuwa wanatumia miadarati. Sasa ilikuwa mimi navuta bangi wakati huo nikiwa second, lakini sasa ile kampani nikashikana nayo ikawa ni kampani ya miadarati. Sasa kutoka kwa mabangi nikaingilia staff.
Sasa hivi unatumia nini na nini?
Sasa hivi ni unga nimechanganywa na roster na cospam, heroin.
Kwa hivyo hiyo ni heroin.
Hii ni
pesa ngapi?
Hii ni 200 shillings. Ukitoa 200 shillings unapewa 10 shillings ndio unanunua hiyo roster ya kutengenezea nayo. Mtu ameweka simu yake vibaya kivyovote utataka kuchukua ndio kusudi nini wewe upate kuvuta na wale wa nyumbani pia hapo hapa, sababu ile ya pale barabarani ambao jasho langu haiwezi tosha kukimu mitaji yangu ya kuvuta na wale wa nyumbani.
Una bibi na watoto?
Inabidi niko na mamangu na wadogo zangu lakini sijaoa.
Na kazi yako haswa ni gani?
Kazi yangu mimi najaza magari hapa stage. Maana niliacha shule na sikuwahi pata kazi, na siku hizi hata mijengo zenyewe ukienda watu wanapeana kazi kwa kujuana. Sisi tunakuwa isolated kulingana na mateja, tunazarauliwa, tunaonekana hatuwezi kufanya zile kazi.
Kwa hivyo
bibi tunajiingiza katika wizi, mambo mengine hatari. Ningeomba nichukuliwe nipelekwe rehabilitation kwa miezi kama 3 kulingana mimi mwenyewe sasa hapa nilipofikia nimechoka na niko mwisho, na hakuna jinsi ambavyo yani naweza nikaamka nikasema ati mimi sivuti na iwe ndio hivyo. Haiwezekani. Sasa nipate msaada nipelekwe rehabilitation nikae huko kwa miezi 2-3 hii dawa itoke mwilini na ndio nitaweza kuendelea na maisha yangu.
Uko ready kabisa kuiacha?
Niko tayari kuacha hata leo sasa niambiwe nichukue vitu vangu twende rehabilitation, niko tayari hata sasa.
Miriam has been on heroin for the last 9 years from a young age of 14. Just like the many cases of child prostitution here, she is introduced into drugs by her then boyfriend who has since disappeared. She is now a single mother, selling her flesh to fend for her baby, gotten on the streets and whose father she doesn't know, and her cravings for the powder.
Acha nikwambie si rahisi juu mwenye unakutana naye umjui na hujaimuona. Na ukiangalia ile ndo anakupa usifikirie eti itakuwa rahisi. Amekupea sana, anataka kutumia pesa yake. Tuseme amekupa punch, anataka kutoka hapo awe ameridhika. Usipomridhisha wengine wanakupiga ama hata wanakunyang'anya do. Kuna mwenye atatumia protection na kuna yule mwenye take advantage of you akutumia hivyo.
Na uwezi kataa?
Hata ukikataa si anakushika kwa nguvu. Wewe ni demu, yeye ni jamaa, kwani unaweza shindana na nguvu ya jamaa? Ndio mzigo ni mkali.
Unasikia aje?
Nasikia sinzia siku sinzia. Nasikia raha, stress free. Hata kama nilikuwa na stress gani sasa sina stress. Inaisha kabisa. Hata kama una njaa pia inaisha.
Hii state ukishafanya hivi ndio unaenda job.
Juu wezi deal na watu kama uko sober. Unakuwa tight. Lakini ukipiga hii kitu una loosen up. Ukifuta unga yani una loosen up. Mtu hata akikwambia mchinga unamwambia poa. Akwambia falo unamwambia. Yani unakuwa tu free, stress free, ujali lolote ukishatupiga hii. Lakini ukiwa soba hakuna kazi unaweza, yaani hiyo kazi yetu hakuna, unaweza rudi hata mikono tu.
Like Fatma, the scars on her body tell a tale of a product of misuse by men who draw their mischimo from their cartilages. At times raped severally with no pay, beaten and stripped naked like a useless slave. The effect is almost spontaneous. Miriam is in another world. Let's talk to her and get to hear what she's feeling. Miriam, unasikia aje?
Nasikia poa.
Unasikia poa?
Nasikia yani nimerelax.
Umerelax? Oh, sahi unaweza fanya anything?
Now I'm active.
Oh.
Yeah, I can do anything right now. I'm stress free.
John, on the other hand, has been on heroin and coke for the last 21 years. Some of the things he's done for the powder are too frightening to capture on camera. Different organizations, including MEWA, have stepped in with harm reduction programs, providing them with syringes and few packages, ensuring they are not continually predisposed to HIV and other transmittable infections. The ladies, majority who are rooted in prostitution to meet their yearning for the expensive powder, are taught safe sex. Majority of the people have a story to tell. A history here, a reason there. To put this into perspective, I'm headed to MEWA, Muslim Education and Welfare Association, one of the rescue centers seeking to give this community a reason to live. It's 11 a.m. East African time and I'm already at MEWA Doping Center, and there's already a series of activities taking place as the management and every other person around is trying to pull every possible strings to ensure that the affected community is well taken care of. Let's see what today will look like. How are you, Mr. Abdallah?
I'm good.
Yes.
Julia.
Thank you so much for having us. Why MEWA? What
Why?
inspired the establishment of MEWA as a drug rehabilitation and harm reduction center?
First of all, MEWA, it's an organization, non-governmental organization. So it is a community-based organization. So because of the drug abuse or drug misuse has been affecting a lot of our community. So as we started volunteering more than 20 years ago, because our brothers and our sisters, people we know who are very, very close to us, they've been addicted to drugs. So we started volunteering to see how we can help them. So it was really hard in the beginning, because we didn't have any knowledge. We were not trained to work in this field, but because of the needs in our community, needs in our prison, needs in our schools, so we say, why don't we volunteer? So we started learning. While doing the work. We were learning on job learning. So we started volunteering for many years because of our community being affected with drug abuse. Then in 2001, that's the time. It's almost 20 years. We started rehabilitation centers. We started rehab center in 2001. We started volunteering in 1990s, 1996, 95. That's the time we started volunteering. Me personally volunteered because my brother used to take heroin. So I started learning and also volunteer to see how I can help him. And at the end, I became full-time working. Like now I'm doing the full-time. So in the year 1990s, in the 80s, mid-80s, heroin was introduced in our locality, where we are staying, in our neighborhood. Then some of our friends whom we used to play with him, our brothers and sisters, they started using heroin. Suddenly they've been hooked and they cannot do anything. So someone needs to start and help them. So me personally, I started volunteering to see how we can help them. It was really hard in the beginning, but in 1997, I think it's around in April or May, during El Nino. So this time I took my brother to one of a rehab center. There's a lady, an English lady. She started just a rehab center. So I went there volunteering. So the first time I took my brother, when he was being assessed, that's the time, that was my first class. So then in 1997, the year 2000, my first training for 3 days training on addiction counseling, 3 days, it was just 3 days. Then I went and started studying about addiction and counseling, and here we are, after more than 20 years. So this is how we started, because of the need of our community, of our people. This is how we started. Until now, we are working for the community. A lot of people who cannot afford to pay, we are helping them. Treating someone or rehabilitating someone is too expensive. So us, in fact, we are the cheapest here in the country, or maybe in Africa.
Okay.
Yeah, because we are trying to do, because we are also helping some people. Some people cannot afford, we also help them without, they don't pay, free of charge. Some people, it's hard, but God is helping. You know, it's too expensive treating one person. It's a residential treatment, so they have to stay there. They have to eat 3 times a day. We have people who are counseling them. We have a doctor, clinician. We have a psychologist. You need a psychologist. You need a lot of people. We need to pay for the water, electricity bill, telephone bill. So it's not that easy. But even our staff, who are working there, they are also like, we are paying part-time, and part-time they are also volunteering.
Okay.
Yeah.
What are some of the programs that you deliver, you offer in?
Okay, Mewa, we started with a rehabilitation center. So normally we do chemical dependence treatment. So we start with assessment, we assess them. We do outreach, we follow them where they are, motivate them, then they come, we assess them, we prepare them, counseling, and assess them. So after assessment, that's the time when we feel that they are ready for rehabilitation, that's the time we start rehabilitation. So the rehab center, we have residential and outpatient. Residential is a 4-month in-house, but before rehabilitation we do chemical detoxification. They go for detoxification under a clinician who normally observe them for 1 week detoxification. So after the 1 week detoxification, that's the time whereby we take them for rehabilitation, where we do counseling. It's a 4-month residential counseling. Okay. So there we normally use the 12-step. We have a program called the 12-step. The 12-step is an international step for Narcotic Anonymous or Alcoholic Anonymous. And we do also training. We train youth. We train people who want to work in this field. We do also sensitize the community. We sensitize the law enforcers, we sensitize the judiciary, we sensitize the community, women, young people who want to work in this field. We do also sensitization on the decriminalization of the laws, because some of the laws, some of the policies are harming the drug users more than even the drug itself. For example, someone, if he has been arrested, he has been found at a place where people are using drugs, we call them maeneo, he can be jailed up to 10 years. Those places have not been gazetted, that these are the places where people are using drugs. There's no any advertisement or anything shows that this is the place where people are using drugs. So anybody can be found there. You're not using, but you can be arrested and jailed up to 10 years. So those laws are harming the person more than even the drug itself. Because this same person you are jailing for 10 years, he has a family. Maybe he's a wife, he has children. He's the one who is looking after them. He has a job, he's working. So if you jail him, the family will suffer, definitely will suffer. He himself he'll be sacked at the job. So so you see, so the same law, but it's affecting the person more than even the drug. He's been using drug, maybe bangi, for many years, and he's been looking at his family. He's been taking his children to school. He's been paying fees and everything. So the bang was not harming him more than these policies or the law. You see, those are the things which you need also to be changed. We do also do awareness programs, schools and the mosques, the church, the radios, through radios, during international days, like during the International Day Against Drug Abuse, during the International Day on World Health Days, during Mental Health Day. So we do awareness on those days. And also we do the advocacy for political change, some of the laws to be changed. So these are just some. But also we have a program on harm reduction. Why harm reduction? Because drug use is harming people. Jailing them, it's also helping them. It's not helping them. In fact, we're even harming them more. People are being jailed, and maybe they've been jailed because of small soft drugs, maybe, or not hard drugs. But when they go to jail, they come out, they start using even hard drugs. So they start using hard drugs in prison. The government is paying a lot of money jailing them. It's cheaper to rehab them than jailing them. You know, one person jailing for 1 year, how much does the government pay for the person? In fighting drugs or trying to reduce drug, we start by supply reduction. Supply reduction is the police, their work is to reduce supply so that no drugs come into our countries. But they cannot do that. It ends up that those people who are supposed to reduce drug or supply, to reduce the supply, are the ones they end up being maybe they're the ones who are bringing drugs in our countries because of the bribe. The business of drug is so big, it can bribe anybody. So they came up with a demand. Then there's a demand reduction. Demand reduction, trying to come up with a curriculum in our school, talk about drugs in our schools, so that people don't need to use drugs. They understand the effect of drugs, but the drug is still there in our schools. In fact, there are more drugs in schools than even outside nowadays. Then the WHO, they came up with a program of harm reduction. How can you reduce harm? What kind of harm? Healthy harm. We can reduce crime. We can reduce maybe sexual infection disease, hepatitis, TB, HIV. So they came up with this program. So all people who are using drugs, they need to be tested. If they are positive, they can access treatment, ARVs. If they can also be tested or screened on sexual transmitted infection. If they are positive, they can get treatment. If they are negative, they can get information how to prevent getting those diseases. TB, they can be screened and tested TB. If they are positive, they can be treatment. Hepatitis, same, and other diseases. Also, they can get information IEC material. They can get IEC material, so they can get information about all other health issues. So to us, we need to view drug addiction as a health issue, not a crime. If we view it as a crime, then there will be a lot of bribe. People will continue using, hiding themselves, whereby they can use in a way that are going to harm them and other people. Women who are using drugs, those who are injecting, most of them, they are also using, they are also sex workers. So they can have sex with anybody. Some of them are our husbands, maybe our wives, our sisters, our brothers, whereby they can also affect others. So there's another substitute therapy whereby you're giving some medicine, methadone, and other buprenorphine, whereby it's a substitute. Instead of using heroin, you are the government is giving a medicine to treat substitute treatment to treat the addiction.
What are some of the processes of admitting a client to?
Okay, first of all is that someone has to desire to stop. But even if he doesn't want to stop, we normally do outreaches. We go where they are, or the family call us, or they bring them to our dropping center here, where they get information, and also we do motivation. We motivate them so that they can know that the drug use is not good. They can change by stopping the drug. And also we in our assessment we do also look at some of the conditions, healthy condition, mental condition. So if we feel that we cannot help them in this condition, we normally refer them to psychiatric or to some other health centers around our dropping centers. And when we feel they are ready now, we send them for detoxification. So detoxification is removing a toxin from their body, because when they stop using drugs, they normally have withdrawals, physical withdrawals, psychological withdrawals, emotional withdrawals. So we normally keep them at a place where residential. It's a medical detoxification. Detoxify them. After that, they go for rehabilitation center where they get counseling. Normally the emotion is too high. So we try to help them to understand their emotion, and also they can control their emotion. Or if they have anger, we normally do the anger management. They can manage their feelings. And also we talk with the family. We normally talk with the family, because family also have been affected. We do family therapy. We also link them with their family, link them together. And after rehabilitation, it's a 4 month. Also they do aftercare program. It's a 3 month whereby they are outside, but they come for session every day. And also they have their supporting meetings, supporting groups. They have their supporting groups where they meet and talk about their experience. Those who have been clean for a long time, they express their feeling, and also they talk about their experience and what helped them to stop. So the new clients they've just come out of the rehab, they can learn from others.
The society handle those who are affected and those who are recovering?
First of them, they need to view them as sick people. They need support from the community, from the society. Without support from the society, it's really very hard. We need to come together and see what's the problem. Because even them, the society sometimes are the problem, are the one who caused those people using drugs. Because addiction is a disease. And it is a chronic disease, like any other disease, chronic disease, like diabetic, like blood pressure, and so they need to continue with their medication. So the community need to understand them, because this is a consequence. Addiction is a consequence of an underlying issues, and mostly is what happened when they were very young. So they need also, them can be also the cause of these people using drugs. So they need to understand them. They need also to learn about addiction and drug abuse, so that they can know how they can help them, how they can work with them, especially the family. I'm talking mostly about the family members. They need to understand addiction. Even them, they've been affected. So they need to get out of denial and accept that this is a disease, not bad behavior, or they've been cast. No. Silana, or it's not that they're bad people, they're very good people. It's just something happened, and everybody can be addicted. Anybody can be addicted. There's nobody who is immune, so that anybody can be addicted. Whether you are rich or poor, or this religion, or tribe, any tribe, anybody can be addicted. It doesn't choose addiction.
This is one of their facilities, a rehabilitation center where those rescued from the streets are hosted, counseled, and rehabilitated. They enjoy a few facilities, from having a roof over their head to flowing showers, food, clean beddings, gym, to library.
if in case there is basically I deal with methadone. So we have methadone and we have different programs. We have 3 different programs. So here we do the plant induction, the induction, we start them on month, we take them to detox, and take them to rehabilitation. And in case of any illness that they have, we normally handle them. So those conditions that come from it here, we do the referral to Makadara due to lack of equipment.
In addition, they have experts on standby, exclusive for both their health and mental needs. Mewa also has a hospital where extreme cases are referred. I get a rare chance to attend one of their sessions. To keep women and their children safe from possible sexual predators, they are hosted in a different facility under close watch of the management. Individuals who have stayed clean for years get time to encourage fellows who've just started their recovery journey. I also get a chance to have a sit down with a few of them, former addicts who've gone through the journey of recovery in Mewa and have now dedicated their lives to helping others recover.
Wana Mewa as a peer educator na vile vile niko kwa volunteership in a rehabilitation center.
Omar, now a community outreach agent, is a former addict. Sent to jail by his own parents at a young age, jailed both within and without the borders of this country, to as far as South Africa and Dubai, losing his wife because of addiction, is a perfect testament of change. He's now dedicated his life to helping others refine their locus.
Yes, I have 3 kids, but I have divorced my wife because of addiction. And I don't know how I end up here, but it was the disease of addiction which ended me up here in this institution. First, I came here and found my recovery here. After a very long time, maybe after 26 years, I've been in this game of addiction. Nilipozaliwa sikuwa na ndoto ya kuwa nitakuwa mraibu. I have a lot of dreams, but definitely things change on the way. Maybe it's I can say society or community or the environment, but I have no one to blame. Nilikuwa na wazazi, successfully parents. Currently I have lost my mother, but my father is still alive. Nilikuwa na very successful family. I grew up in Majengo. I was at school. I didn't finish my school, but I end up in the drugs, and sahi ndo vile maisha yangu yanaendelea. And all I can say is that I wanted to copy. You know, watu wakienukia wanataka kukopi vitu. Kuna mtu anataka kukopi football, mwingine anataka kukopi basketball, but I wanted to copy the crimes and drugs and everything. So nilijikuta tu kwa sigara, tena nikajikuta kwa marijuana, tena nikajikuta kwa heroin, tena nikajikuta gerezani. So when I went to the prison, I think that I went to Boston prison at the age of 16. My parents took me there. What they thought it was like, tukimpeleka jela atatulia, but pale jela napo nilikutana na watu tofauti kutoka Nairobi, kutoka Kilifi County, yani watu tofauti, then hatukuwa na kitu muhimu cha kushare kwa ile gereza. Our first and last word is that safari tumeiba na kisu, tukitoka tujaribuni tuibe na bunduki. Za kusema it's kwa sababu nimekuja kujua after recovery ni kwa the disease of addiction, it's no one's fault. Huwezi kumnyoshea mtu kidole kwa sababu the choice was mine. Na wakati ule kulikuwa kwa, nafikiri nikianza heroin kulikuwa kwa amna institution kama hizi rehabilitation, kwa hiyo watu wengi sana walikuwa hawana awareness ya drug, what is drugs. Watu walikuwa kwa sababu majaji, serikali ilikuwa inasema hawa watu wafaa wahukumiwe gerezani, so wale maimamu na mapasta wanasema hawa watu wamelaaniwa na Mungu, society inasema hawa watu hatuwezi kukaa nao. Then after I came in the door of recovery, I found that watu mimi nilikuwa mgonjwa, lakini nilikuwa si mimi, kwa sababu I was living to use and used to live. Supported me when I was an addict. Nobody wanted me to be nobody wanted me at home, because every time it was very worse. Police knocking, society knocking, why Omar is doing like this. My father was very shameful. Sometimes my father used to tell me, Omar, I cannot go to an occasion. I cannot go to the wedding because all the people there are pointing at me. They say, hey, that man, his son is a very bad man.
Check on the others. Do you get craving? Or
a lot of craving, but instead of thinking the man who is smoking there, I feel he's very happy. But for me, I'm thinking different. I am thinking the consequences. If I'll relapse, things will get more worse than that, because my system now has, I can say, has imekuwa ya kibinadamu.
Abdallah is also a recovering addict. In his own admission, with friends in jail and others dead, he is seeking a path to a different life. There are things he regrets about his former life. A long journey this might be, but I can't help but wish him well.
Nilipofuta nikaingia mtaani sasa. Kwa street huko. Pesa yangu napata ni kuibia watu ndo nipate kuishi.
Kwa hivyo kuna wale mliwanyang'anya vitu, kuna wale walipigwa.
Kuna wengine walikufa pia.
Kwa hiyo process. Na marafiki zako wengine wameponea, wengine
wengine wako jela, wale wako jela. Hao wengine waliuawa na mob. Kiembeni walichoma.
I'm now headed to Sarova White Sands, Mombasa. Coincidentally, there is an important conference on drug bringing together different organizations, including Kenya's NACADA. It's through such platforms where policy affecting this community are formulated and donors willing to support such recovery journeys invited. Majority of those we talk to raise concerns of the existing disconnect between policy-making bodies and some institutions trying to help them and their actual conditions on ground. I hope to get a chance either to prove or to disapprove their claims, and also to get to know their plans underway. I'm at Sarova White Sands and I'm attending a conference on drugs, bringing together different organizations, including USAID. I'll get inside and talk to one or two individuals and understand more on whatever is going on.
I'd like to welcome all of you and thank you at the same time for your commitment to contribute from your different organizational perspectives and different areas of expertise to the objectives of this workshop. including learning from each other and then the development of the Kenyan growth plan to enhance options for effective non-custodial.
True to their words, there seems to be a disconnect. Only a few of the attendants seem to have the basic knowledge of the actual happenings on the ground. Majority relied on theories brewed in suits and heavy allowances, hardly engaging the addicts on the streets. It is thus, in my guided opinion, that it is now ripe of the country and the world to move away from boardroom policy making, where doors are shut from the public and the affected, theoretical textbook knowledge shared by the people who hardly understand situations on ground, and blanket operations conducted that hardly result to change be aborted. I was surprised that such an important program would be shut completely from the public watch and information capture and sharing greatly limited. The world appears to be doing much in attempt towards curbing addiction, but so little seems to be actually happening. A case of seeing a wall for a brick or a brick for a wall. Let the conversation begin.